October month, we can pass the right information across. Don't go to a doctor who is not skilled in attending to your problems.
Asking questions from Dr. Google, from TikTok, Facebook. Unfortunately, there are a lot of charlatans out there.
There are a lot of myths and misconceptions surrounding cancer.
Everybody thinks breast cancer is the same disease.
They said chemotherapy will destroy the cells in your body.
It will make you darker in color, make you very sick.
It will kill the person.
All medicines are quote and unquote poisons. My breast cancer patients die from lack of knowledge.
Honestly, in the cancer space, things are changing. A lot more can be done.
Breast cancer is not a death sentence. It can be cured.
Every October, the world turns pink, not just in color, but in purpose. Behind every walk, hashtags, and ribbons lie real stories of women who have real challenges. This episode of the LUTH Podcast is in honor of Breast Cancer Awareness Month. We'll be joining the global conversation through a Nigerian lens.
In this segment, we'll be talking with Dr. Lawal, a consultant surgeon with specialization in breast surgery. He'll be sharing his unique surgical perspective of breast cancer care in Nigeria. I'm Divine, a medical student here at LUTH.
And I'm Courage Adesanya, also a medical student, and will be your host for this special breast awareness program.
We know that the topic of breast cancer is often overwhelming, so we'll be starting with something light. Dr. Lawal, please tell us, what is one thing you always tell your patients, but secretly sometimes forget to do yourself?
Wow. Do I tell my patients anything? Breast patients, you mean?
Yes, sir.
Well, interestingly, I am a man, and I always tell my patients to always do breast self-examination after every menstrual cycle. But I don't do it myself. Could it be because I don't menstruate? Well, possibly. So I don't usually do breast self-examination after menstruation because I don't menstruate.
Thank you so much, sir. So now we're talking about LUTH, which is one of the leading cancer centers and research in Nigeria.
Interestingly, we have the leading cancer center in West Africa, not Nigeria. So yes, it's the leading in Nigeria and the leading in West Africa.
Okay, sir. So from a surgical standpoint, how is breast cancer treatment evolving here in LUTH? Are there newer, less invasive techniques that you use here to improve the patient's outcome?
The techniques that are available have been available for a very long time, but it is the deployment of any of these techniques is significantly dependent on the patient, is dependent on the disease type. Interestingly, breast cancer, everybody hears breast cancer and thinks breast cancer is the same disease. In fact, breast cancer from one woman may actually be different from that of another woman. And what do I mean by that? There are different ways we can classify breast cancer, from the most basic, which is ductal carcinoma, lobular carcinoma, ductal carcinoma with mucinous variant, and so many other types. But the most common types are the ductal and the lobular subtypes of breast cancer. Even in the lobular and ductal types of breast cancer, we also get to realize that there's something we call immunohistochemistry. The way I explain it to my patients is that, we are all Nigerians, that's breast cancer. Now, the geopolitical zones, we have the southwest, southeast, south-south, northwest, northeast, north central. Those are the invasive ductal, invasive lobular, and things like that. However, in any of these geopolitical zones, there are still subdivisions. So that is when we start talking of things like, is it hormone receptor positive? Is it hormone receptor negative? Is it HER2 receptor positive? And is it triple negative? Is it triple positive? Is it quadruple positive? So when we are talking about breast cancer, it is not one single disease. Apart from that, the staging also matters. So it's not as if there is, like they say, there's nothing new under the sun. However, with respect to surgical care of breast cancer patients, it will depend on if the patient comes early enough and the relative size of the cancer to the size of the patient's whole breast. What do I mean? If the patient comes early enough and the breast cancer is still small within the breast, it is possible to remove only the breast cancer and then we preserve the breast. But unfortunately for us, most patients do not come at that time. They come when it has taken up half of the breast or sometimes even the whole breast. In that situation, the surgeon has no choice but to recommend that we remove the whole breast. However, I can assure all the women out there, if they do their screening and they come with early disease, it is possible to do surgery to remove only that lump without compromising their breast. Sometimes also, if patients do not come early enough, but they respond very well to chemotherapy. Interestingly, patients are very averse to chemotherapy, whereas it is a lifesaver. If they respond very well to chemotherapy and the big lump becomes very small, and the size of that small lump relative to the size of the breast is amenable to just removal of that lump, then it is possible to actually remove only that lump without removing the whole breast. That is one aspect of treatment for breast cancer surgically. Another surgical aspect of treatment for breast cancer is that we can actually remove a significant portion of the breast whilst either remodeling the breast and then reducing the size of the other breast. Another aspect of what we can do is that we can actually remove the whole breast. In removing the whole breast, the question then would be, what then do we do? Am I going to go through life without a breast? Well, for some that may be the case, but for a lot of our patients, after they've been properly treated, it's sometimes possible for us to create a new breast for them. In fact, I used to joke with my patients and tell them that, if you didn't like the size of your previous breast, you can actually talk to us and we can give you the new size that you prefer. If you prefer a smaller size, we can do it for you. If you prefer a bigger size, we can do it for you. So even though women get treated with surgery by removal of their breast, they can also get their breasts reconstructed and they become very beautiful with it. In fact, I tell them the story of a very beautiful actress in the United States of America, Angelina Jolie. She went and removed both of her breasts, and after removing, she had new breasts put in, but she didn't change the size. She left the size the way it was before because she liked the size. So, I like talking about breasts.
Thank you, sir, for addressing the fear of mastectomy. So earlier during the course of your conversation, you mentioned that some patients are averse to having or undergoing chemotherapy. What are some of the concerns that they have expressed to you personally as a surgeon?
Well, chemotherapy, despite being a lifesaver, is actually a victim of the information superhighway. Most patients these days go about asking questions from Dr. Google. They don't ask questions from doctors around them. And they believe Dr. Google more than the doctors around them and the specialists. Unfortunately for us, they tend to get a lot more information. Even these days, they are even moving away from Google. They are getting their information from TikTok. They are getting it from Facebook. They are getting it from Instagram. And unfortunately, there are a lot of charlatans out there. The fears that patients have expressed are myriad. And I just want to tell you just a few of them. One, they believe that chemotherapy is poison. Well, to a large extent, they may be correct, but it's actually a matter of risk versus benefit. And once you have looked at the risk and you have seen that the benefit far outweighs the risk, then you would actually, in fact, all medicines are quote and unquote poisons. So, to some extent, we can say that they are right, but they are not looking at it in proper perspective. The other fears they have expressed to me are, they say it will make you weak, it will cut off your hair, it will make you darker in color, it will make you very sick. But what I keep telling them to reassure them is that, look, this is only for a very short while. And the Yorubas have a saying that Iyatolojo Lamfarada. What it means is that when you know that you are going to undergo a timed suffering for a benefit in the future that would extend for a longer period, which comes back to my risk versus benefit. And we think that the benefits far outweigh the risks. In fact, I've seen, unfortunately too, there's a self-fulfilling prophecy in it. And what do I mean? Most patients that refuse to take chemotherapy when they are advised to, their tumors continue to grow and advance. By the time they then have very terrible disease and it has gone all over the place, that is the time they then start begging for the chemotherapy that they had said they didn't want before. But unfortunately for all of us, as at the time it will have been a little late, and when they start administering chemotherapy to them, we'll then find out that despite the chemotherapy, they may not make it. Then it will be like, we told you that chemotherapy kills, and then it becomes a self-fulfilling prophecy. They do not see the millions of people who accept treatment early and get healed from chemotherapy. So I want to reassure our patients once again that chemotherapy is a lifesaver. Please take it whenever your physicians recommend it, because they have weighed the risk, they have weighed the benefit, and they found out that the benefit in your circumstance far outweighs the risks. Thank you.
Thank you so much, sir, for addressing those concerns. Now, we know that leadership in medicine is not just about treating patients, it's also about shaping the systems and inspiring hope. Now, can you share with us the biggest challenges Nigeria has in breast cancer awareness and treatments?
When you talk of biggest, and there are many biggests, it then becomes very difficult to talk of biggest. Well, two biggest challenges. It is a grammatical misnomer because biggest is only one, but I have put them as biggests. So there are two biggest challenges. One of them is poverty. Treatment of these diseases costs a lot of money. Therefore, a diagnosis of breast cancer is a sinkhole, and it is only those who are blessed that actually survive the financial drawdown for this disease. Another biggest challenge in the treatment of breast cancer is ignorance, lack of knowledge. Even though I am a Muslim, I still make bold to say the Bible says my people die for lack of knowledge. My breast cancer patients die from lack of knowledge. A lot of them would notice this early. They would come to hospital early. You would give them their treatment plan early, but they will then go and get their treatment plan from TikTok. Somebody says take soursop. Somebody says take no fat, no carbohydrates, that you are going to be feeding the cancer. Take vitamin B72, all sorts of funny, interesting, apologies for the language, very stupid things. And at the end of the day, they then, like fella would say, they still they perambulate and go still the same place. In fact, if they were in the same place, it would have been better. They then come back to you in a worse place. And unfortunately, by that time when they come, like I keep saying, then becomes a self-fulfilling prophecy. They are told breast cancer will kill them. They are told if you go to the hospital, you're going to die. They have come to the hospital early, they should have been cured. They refuse to take treatment when they would have been cured. They then come back when the treatment is only palliative. Now, what do I mean? Let me digress a little. When we are treating breast cancer, we want to have goals of treatment. Unfortunately, patients will not come out and tell you that they've been told their goal of treatment. If the patient comes with early breast cancer, the goal of treatment is cure. And we have several stories of patients that have been cured of breast cancer, patients who lived 10, 20, 30, 40 years after their diagnosis of breast cancer and died of other things. However, if a patient comes with locally advanced breast cancer, those kind of patients, the goal of treatment is no longer cure, it is containment. Then patients who come with advanced, what do we mean by advanced? What it means is that, let me talk what we mean by locally advanced versus advanced. If we say locally advanced, what we mean is that it is still restricted to the breast and the armpit, but it has not gone to other parts of the body. Even though we say it's breast cancer, sometimes the breast cancer can move from the breast and go to the lungs. It can move to the bones, especially bones of the spine. It can go to the brain. It can go to the liver. It can go to the lungs. It can go to the chest. Therefore, in patients who have advanced breast cancer, which means that it has spread beyond the breast and the armpit, for those patients, the goal of treatment is what we call palliative. And what is palliative? We would have told the patient that, look, we cannot cure you, we cannot rid your body of this cancer. However, what we can do is that we can make your life comfortable. We can try to ensure that you and the breast cancer will live a life where the breast cancer will not make you too uncomfortable. Eventually, most patients who have cancer, eventually, if it is not properly treated, will succumb to the metastatic disease. That is the disease that has spread beyond the breast, not actually the one that is in the breast. So that is that aspect of the treatment.
Okay. Thank you so much, sir.
Joining us today is a brilliant mind. Dr. Alabi is a consultant clinical and radiation oncologist here at the MedServe LUTH Cancer Center. She is dedicated to improving cancer care and patient outcome in LUTH.
Thank you so much for joining us today, Ma. It's such a privilege and pleasure having you here.
Thank you, Divine and Courage. I'm glad to be at this episode of your podcast.
Now let's step into the professional world a little bit more. So we know that breast cancer is not just a diagnosis; it's a journey of early detection, treatment, and emotional resilience. Now, Dr. Alabi, oncology is a field that demands both science and empathy. What inspired you to choose this field, and what keeps you motivated in such a demanding specialty?
Oh, okay. So you're trying to ask me, how did I get here? Yeah, which so many people have had to ask over the years. And I think it was divine. I think God wanted me here. I'm not sure this is what I chose for myself. This is obviously not what I chose. But somehow, somewhere, somehow, by divine connection, I am where I am today. And I think I have no regrets, because I think God has put me here. And I've not seen it just as a specialty, I've seen it as a calling. Okay, and so when you see something that you do as a calling, you get fulfilled in it. So to people, that is not where they want to. Where you have so many morbidities and mortalities. Who wants to do that kind of a thing and break cancer diagnosis news? But I don't look at that. I look beyond that, and I look at the lives I have impacted, the lives I have made happy, the people who have had treatment. And imagine a cancer patient walks into your office that you treated 10, 15 years ago and is alive and is cancer free. That gives you motivation to want to do more. That gives you motivation to say it is not a death sentence, and you want to tell the next patient that comes to your front and say it's not a death sentence. You can also beat cancer. You can also survive it. So I think over the years this has helped me. And just like I said, I don't see it as just that specialty that I chose, but as a specialty that I'm divinely called to do.
Now, let's talk about LUTH, one of the leading centers for cancer care and research in Nigeria. Dr. Alabi, what makes LUTH stand out in breast cancer management compared to other teaching hospitals?
So, you haven't said wrongly by saying LUTH is a center of excellence for cancer management, because in LUTH we have the most established cancer center that has facilities that you will not get in the whole of West Africa. Okay, I don't want to brag too much and say maybe in the whole of West and East Africa or Central Africa, but let's just keep it to West Africa. And so you have dedicated oncologists, you have dedicated specialists, surgeons, multidisciplinary team approach is what we've always used. We have psychiatrists, we have psychologists, we have dietitians, we have counselors, we have surgeons, we have gynecologists, we have oral and maxillofacial surgeons. So we have ENT surgeons, we have all the specialties that you can think about. And we all come together, we meet on regular basis, we discuss patient care, we take the patient individually and choose what is best for them. We have a dedicated breast clinic where anyone who has a breast complaint, you don't know what it is, you just have a breast complaint, just walk in, see a doctor, get attention, have all the things. We even call it a one-stop breast clinic, where you can have diagnosis made there, right there on the spot. Biopsy can be done, imaging can be done, So we have a patient navigator program in place. So we have so many of all these things in place. I'm not even talking of the equipment and infrastructure that we have in the hospital that has to do with making a diagnosis of cancer in the labs and what have you. Okay, I'm not talking of the equipment that the cancer center has in terms of the 3 linear accelerators, having the brachytherapy machine and all the likes. And so because of these and many more, And what I've noticed over the years, because patients come from other parts of the country, other parts of the country, and even outside the country, neighboring countries, Cameroon, Sierra Leone, Togo, and the likes. And when they come, one thing that stands out is they see that we are intentional about our treatment. We're not just treating them as let's treat and go. We want to treat, we want to follow up, we want to see what is the next, we want to tell them what they need to know. We give them adequate information. So we're intentional. We're not just there where we don't treat because we want to make money or want to exploit them. We treat because we want to get them well. We want them to have good care and good quality of care. And so that is what for me has stood out for the hospital. And I think we have done a lot. We have done a significant lot in patient care when it comes to cancer management.
When you answered the question before this, you mentioned that a lot of people fear the unknown, right? So many people fear having a breast cancer diagnosis. So what is LUTH, the LUTH team? How are they supporting them beyond medical side? How are they supporting them emotionally, socially, and psychologically?
So remember that I said we have a multidisciplinary team in place for cancer management. For example, if a cancer patient walks into the cancer center today, so apart from the patient coming in, whether the patient has had the diagnosis told to him on her or not, we have a structure in place where the patient gets to see a counselor and a psycho-oncologist. So this is not, oh, I don't have a mental illness, I don't have something wrong with me upstairs. So because it's a diagnosis that can be challenging, that many of them would have one form of distress, okay, or the other. And so we put structure in place that they will have a counselor and they will get to see a psycho-oncologist to attend to them, to assess them. We even have a scale. We have what we call the distress thermometer that can assess the scale of their level of distress, and we can manage. Some may need drugs, some may need further care, some may need further review, and some may not even need anything. Okay, so we have this in place. So the cancer diagnosis, yes, comes with fear, comes with tension, comes with a lot of worries and concern. So, but part of what we do is to make sure that when they come to us, we give them adequate counseling so that we can let them know what treatment options they have and what care they will need to go through. So that's what we do for them.
So far that this system has been put in place, have you seen success stories?
A lot of success stories, okay? So a lot, and this is what I'll say. So many people get to me and they'll be like, but that's not what they thought. Oh. That's not what they were told. That's not how they have perceived it. Are you saying, doctor, if we take this drug, everything will be okay? So they never, many of them never come with that intention. Many of them have, there are a lot of myths and misconceptions surrounding cancer treatment, and what have you. And so a lot of people will come and say, oh, they said chemotherapy will destroy all the cells in your body, will kill the person. Oh, radiation treatment, the radiation will burn the person and the person will die. And then so we also do what we call focus group discussions. And we also do, we have this program, I can't remember the name, we call it Do Hope Alive or something. Okay, such that we hold webinars every month and we have a dedicated team. So any patient who comes automatically gets sent an invite to join. And so it's like a group forum for the patients to meet with survivors, to exchange information and to ask questions about their diagnosis and their treatment. And so when we have all these things in place, when patients come, what they get to hear is different from what they have known before. And so that way they feel more comfortable to have the treatment. So a patient who comes in and is afraid of radiation because she has read that radiation will burn all the cells and everything. And then all you just need to do is say, Ma, do you mind if I introduce you to someone who has finished radiation treatment? If that person who has finished radiation treatment comes and discusses with her, she can ask, oh, how did it go? And then she's better informed. So if she's better informed, her fears are less, and then she's more hopeful and expectant that her treatment will go well. So somehow, that's how we have been able to navigate it and help people out with their concerns and their fears.
Wow.
Thank you so much.
Thank you.
This was such an eye opener, and from learning about how the treatment or how the patient presents actually affects their treatment to the goals of treatment, we now have a better understanding of what is being done here or what is done internationally actually for breast cancer management. We've learned today that early detection and appropriate treatment saves life, not just early detection. So remember to check yourself, get yourself screened, and don't forget to tell someone else as well. Also, don't forget to like, share, and subscribe, and tell us in the comment section what part of today's conversation stood out the most to you. We'll be back again soon.